Good afternoon, folks. We'll get started here in a few seconds at the top of the hour. Good afternoon, everybody. Welcome to today's webinar. My name is Mike Willett with the Intertribal Council of Michigan, and our webinar today is titled Vaping and Mental Health in Michigan Teens. Your speaker today is Stefanie Jackson, a public health advocate, also a program coordinator for the Wayne County Health Department in Michigan. There's no commercial interest support used to fund this activity. And as a result of participating in this activity, the healthcare team will understand the relationship between vaping and mental health in Michigan teens, supported by regional data and studies, identify risk factors and protective factors such as peer pressure and social media influence, and discuss protective factors like family support and mental health resources that can mitigate these risks, and discuss evidence-based strategies and programs that address both vaping prevention and mental health support in Michigan teens, emphasizing culturally relevant approaches and community involvement. If you have any questions during today's presentation, please type your questions into the Q&A box in your Zoom webinar panel. The questions will be answered aloud at the end of today's presentation. Also, we will be sending out an evaluation based on today's presentation. The evaluation will go out over the next 24 hours, and we do ask that you please let us know how we did, give us some feedback, and please go ahead and complete that evaluation tomorrow. And now at this time, I will toss it over to Stefanie Jackson.
Morning, everyone. I'm Stefanie Jackson. I'm so humbled to be here today and able to share my study and current trends that we are looking at regarding our teen population. Let me just go ahead and one second, I've got to hit that button. Oh, I have it. Hey. So we're going to go over exploring mental states and vaping behaviors of U.S. female teen e-cigarette users, emphasis on American Native and Alaskan Indian. So we'll go over the health issue, the origin and barriers, theoretical approach that will be utilized, methodology, and some tips and takeaways. So, excuse me. So I'm focusing in on U.S. teen girl population and what are some of those social determinants of health and issues that I have found have been part of encouraging our teens to adopt that unhealthy behavior. So from 2011 to 2021, a lot of our teen girls were having symptoms of depression, sadness, hopelessness, different type of mental health issues compared to boys. You can see here at girls have increased that with 57% to the 29% of teen boys. girls who experience sexual violence increased 20% between 2017 and 2021. So that's another variable that we're looking at. As well as attitude and beliefs about tobacco. So when we look at those caveats, smoking cigarettes makes them cool, using e-cigarettes makes them cool, smoking cigarettes attracts more friends, using e-cigarettes attracts more friends. We're all looking at that social component in every aspect of this test or survey rather. So we can see right here what those attitudes are looking like versus no. Okay. All right, so there also was a 30-day survey that was conducted of how the e-cigarette was obtained or their access to it. So here we have 20.67% bought it by themselves. Someone else purchased the e-cigarette or device, 25.14%. Okay, so we know that this is social connection here. 20.60% borrowed or bummed them for someone, so just received it for somebody else versus somebody buying it. A person who can legally buy these products gave them to me. That's at 10.6%. I took them from someone, sold it, however, that was 2.79%, and I got them on the internet, which was 1.12%. So we're going to talk more further into the facts about vaping. Okay, it does cause lung injury. Nicotine can permanently change the developing teenage brain because that brain does not fully develop until 25 years old. With the 2018 survey, there was 10 million youth in the United States that used e-cigarettes, as well as 8th graders who vaped are 10 times more likely to eventually smoke cigarettes than their non-vaping peers. Between the years of 2017 to 2019, there was a 135% increase in high school students. So because I noticed that, that also employed me to look more so at that population of high school students. 60% of young people think e-cigarettes are mostly flavor. The truth is that more than 98% of products tested contain nicotine. Okay, so again, we're getting attracted by that flavor. And I did also add into my study later on, I would like to look at the aspect of how nicotine impacts mental health associated with the vaping behaviors. So that's just something that needs to be added on. So let's look at current tobacco use of e-cigarette use and cigarette smoking rates among high school students in Michigan. Okay, and this is compared by average of boys, female, and male. Okay, so we have here is females. You see that increased number. We have here for e-cigarette use at 16.4%. Males are 6.8% for Michigan, and then the national rate is 15.4% for female and 12.8% for males. And that's the 2023 survey. So what about American and Alaska Native teens? So let's take a look at that. Let me pull this down right here. Hold on a second. So this was provided by Truth Initiative. And we have here higher e-cigarette use rates versus the regular smoking rates. So we have cigarettes. So for high school is 40.4% American Indians and Alaskan Natives versus other racial ethnicities, 27.5%. Okay, and then we look at this middle school variant, it was 16.1% versus the other racial or ethnic groups at 10.5%. So, what are the statistics? So, the highest rate versus the overall was 5.8% for high school, 2.3%. Now, this came from the 2019 Youth Tobacco Survey. And then I wanted to mention also we had 16.2% American Alaskan Native high schoolers and 3.7% middle schoolers. So that's from the 2019 Youth Tobacco Survey. So this is just another demographic where we're still seeing that 40.4% versus overall. So this is all the races and ethnicities for high school teens. Okay, let me push this one down a little bit so you guys can see this one. Okay, so this is just another aspect of that. So I did want to look at hookahs, but there was not enough data for a correct reading or unbiased reading. So they're still looking at this one. But as far as for cigarettes, for female teens, AIAN is 7.0%, but we have that increase of 19.4% for e-cigarettes. All right, so why are Native youth more receptible than non-Native peers? So the social determinants of health that we have identified are higher rates of poverty, access to quality care, health inequity, extreme gaps regarding health care, health services, integrational stressors, socioeconomic statuses, trauma, disconnection from cultural traditions. And that brings us more so into looking at those cultural and social norms between e-cigarettes versus sacred tobacco. So, commercial tobacco is designed for recreational and habitual use. It's sold for profit, contains over 7,000 chemicals and compounds, immediate stimulation followed by mental health issues. So, that's where that nicotine component is going to be studied a little bit more in depth. But by informing the population of these health issues and the reason for where the target is for commercial tobacco and why they are targeting the youth with the flavors, we need to counteract that by educating them on sacred tobacco, which we all know within the tribes the importance of that, taking pride in increasing knowledge for the youth, immersion of teens in Native American culture, youth mentors as sacred leaders, learning from elders on the importance of that sacred tobacco, traditional harvesting practices and rituals, increasing health literacy on commercial tobacco, those harmful effects, e-cigarettes and hookahs, educating them, and going full circle back into having pride for sacred tobacco rituals and traditions. So I do have a video here as a reminder of one of the great components that you guys have worked with. I'm just pulling that up. Let me see where I have it at. Oh, okay. So back to it. And this is from the National Native Network. You all are familiar with. And this, I just wanted to share this again as far as tying how important it is to educate our youth on sacred tobacco and how it's important to distinguish of what that is for the culture versus the commercial tobacco and the harmful chemicals and health issues that are associated with that behavior.
Historically and traditionally, our culture has been a culture of observant people. With wisdom, our ancestors gathered much information and applied the lessons learned to benefit their lives and the lives of the present generation.
And what I want to do today is share some facts with you about the use of commercial tobacco and how it's harming our people. See, the commercial tobacco industry doesn't want to tell you this, but they're adding about 60 different cancer-causing agents, as well as about 4,000 plus chemicals that are very harmful, like arsenic and rat poison.
And that nicotine is the addictive drug that is in even higher amounts in smokeless tobacco.
And so these things ingesting in our bodies are hurting us, hurting our future generation, our elders. You know, it's killing our people.
Big tobacco companies breed on our cultural ways, touting their products as useful to us when in reality they're deadly and far from sacred.
See, when we use commercial tobacco in our ceremonies, what we're saying is that we're ingesting these chemicals and these harmful things into our body. Again, we're not protecting ourselves. So what we want to try to do is to educate about the harmful uses of the harmful things in commercial tobacco. That way we keep our ceremonies sacred to us. And going back to what our elders taught us in the observant philosophy that we want to keep ourselves strong and healthy. So in the long run, we want to make it and keep it sacred to us.
Together, we as elders and parents and grandparents and this present generation are responsible to teach and to be role models, to carry our culture into the future. Like our ancestors, let us observe and apply the lessons learned into action. Will you stand with us today to say no to commercial tobacco products in our cultural and personal uses? Together, we can keep it sacred.
Okay. All right, back into this one. Okay, so talking about a little bit further as the mental health states that I'll be looking at within the study that I've conducted based on these vaping behaviors and mental health will be nervousness, anxiety, self-worth, loneliness, as well as depression. So within COVID, we did see an increase of vaping behaviors. 37% of high school students reported they experienced poor mental health during this time. 44% reported persistently felt sad or hopeless. 55% reported experienced emotional abuse by a parent or other adult in the home, including swearing at, insulting, or putting down the student. 11% experienced physical abuse by a parent or other adult in the home, including hitting, beating, kicking, or physically hurting the student. 29% reported a parent or other adult in their home lost a job.
Hey,
So with
Stefanie,
this, yes.
just real quick, I think that you need to switch over back to the PowerPoint slide deck.
Oh, it's not showing up?
No.
Okay, let me hit stop share. Sometimes it does that when you go from YouTube to the other. Okay. Are you guys able to see now?
Looks good.
Okay, perfect. Okay. Okay, so like I said before, with these issues compound with the social determinants of health that I previously mentioned, these teens are in desperate need of assistance for a core implementation of an effective program. Okay, so The theory that I selected was Doctors George Engel and John Romano biosocial spiritual model. Encompasses a holistic, integrated approach to the psychological, spiritual, social, and biological well-being of the target population. Increase understanding and knowledge of current mental states due to the individual's ecological system, that's their environment. Identify factors, controls associated with vaping behaviors. And then the controls of the study are race and e-cigarette use in the home. So the test is a systematic quantitative approach and cross-sectional design. The limitations of the study are lack of resources for data collection, excluding those certain studies did not exclude U.S. female teens that are homeschooled, non-enrolled in school teens that are juvenile detention centers. Those teens were not included. Secondary data that includes self-reporting by participants will also increase bias. Possibility of ignoring contextual factors or human complexities that may influence mental state and health choices that affect the data validity and interpretation. So the case study that I looked at was through the American Heart Association, and their variables were depression and anxiety symptoms linked to vaping, nicotine, and THC in teens and young adults. So that study findings were that vaping, nicotine, and THC is the psychoactive component in marijuana was associated with self-reported symptoms of depression and anxiety. Okay, so the additional study was one with vaping and mental health by Patton. They provided discussion on adolescent and youth e-cigarette smoking perceptions, patterns, and gaps within research that have previously been conducted. And the finding for that one was derived from the Canadian Tobacco and Nicotine Survey of 2019. This survey identified that ages 15 to 24 reported within the past month 15% frequency use of e-cigarettes compared to 3% frequency in participants over 25 years of age. So that was another marker that I wanted to look at as far as the teens are, again, using more than adults over 25. So my question, I have the first one is, to what extent does current mental states predict vaping frequency among female U.S. teen e-cigarette users while controlling for race and e-cigarette use in the home? The independent variables, again, are those same ones: little interest, pleasure, depressed, hopeless, like I talked about before. The second one is, to what extent does current mental states predict access of e-cigarette use among U.S. female teen e-cigarette users while controlling for race and e-cigarette use in the home? So those are the questions that I'm going to be looking at. And also, based upon those results, if we have that data, the social change that I want to occur is mental states, dual use and concealment, health literacy level, social aspects, and norms. So this is just the measurement grid that the test will be based off of. Okay, as well as the takeaways will be the holistic approach, strengthening empowerment and autonomy, identifying barriers, biasness, and challenges, also reviewing over the current policies. Okay, account for manufacturers that are not successful preventing widespread youth use of their products, entire category of cartridges. Also looking at nicotine, marijuana, and THC. and to have those results that I have collected utilized for a behavior change. Okay. And then before I go into that part, I did also want to share with you all. No, a second. I'm just trying to find where I put that one grid. Okay, this is it right here. Okay, are you all able to see my screen?
No.
Okay, here it is. Okay, so for 2023, this is from the National Youth Tobacco Survey, where we have our race and ethnicity here. For e-cigarettes, for AIAN, for female is 19.4% versus the 14.4% of males. So I thought that was very interesting. So within the study, I'm looking forward to see what the data is going to show as mental health issues within the population of teen youth broken down by race to bring back to the council. So that's the end of my presentation, and I'm open to questions.
All right. Thank you very much, Stephanie.
Absolutely.
So if anybody has any questions, go ahead and type them into the Q&A box. While folks are doing that, or while we're waiting for questions to pop up in there, we can take care of a little housekeeping. Again, we will be sending out an evaluation with SurveyMonkey. It should be coming in your emails through Zoom, and I'll even send one out as well from my email address too. Just send out the link to the evaluation. So if folks would like to check that out, that would be helpful just to let us know how we did. And also, I do want to share that you can follow us online. I'll share my screen just a moment to show you where the social media handles are for us. And we do have a ton of material on the keepitsacred.org website that has material for menthol and other vaping products, flavored tobacco and vaping products that folks are able to go and check out. Also, this webinar will be archived on the website as well under the resources and webinar archive tabs. So if anybody would like to go back and review the website, or go back and review and share the presentation for today, then you're welcome to do that. So far, I don't see any questions in the Q&A box, but it looks like we do have some folks that attended the presentation. We do have some folks that came from the Hannahville Indian community, Little Traverse Bay Bands, Sioux Tribe, Bay Mills Indian community. So yeah, it looks like there was a lot of representation across the state, which is tremendous to see here.
I have a question.
Go ahead, Heather.
Yeah, Stephanie, so excellent data. I think it's really relevant and important to the work that you're doing, and especially representing some of the populations that are experiencing these extremely high disparities, like ours, the American Indian Alaska Native population. So I really highly appreciate what you presented today. And you did kind of focus a bit on COVID and how those factors have influenced mental health. Could you kind of expand a little bit more on some of those issues that were experienced then, and then kind of how they're correlating now that things are more opened up? Are we seeing more, are we seeing continued isolation? Are we seeing continued high rates of anxiety and depression because of the shift that's been made since COVID to more of some teams taking a virtual learning style?
Yes. We are still seeing, even though we have opened up everything, COVID is, somewhat done since everybody is now in person, face to face. We still are seeing teens with that isolation behavior. But we do need to do a measurement on that as compared to before pre-COVID, because we basically had 3 stages that we're going to look at: pre-COVID, during COVID, post-COVID. So we have to have a measurement for that. And then it's basically just trying to reestablish in persons, dialogue. And you see more teens now utilizing social media than face-to-face communication. So with that being said, we're still looking at the same type of behaviors as before, with anxiety, depression, still loneliness because they're isolating still. So we're going to have to still look at those trends.
Based on your kind of very early findings, I know you're still in the kind of middle stages of this study. Do you have any recommendations for our tribal partners on how they can address this isolation behavior and promote healthy living and substance abuse and nicotine dependence in teens?
Absolutely. There is, I believe it's Truth Initiative. They have a mobile implement program. And then, so basically it's just encompassing a group. So either you can, since I feel that you can utilize the social media as like a group app, like what's up app or the group me apps, to cultivate a peer group. And then also introducing more of those cultural aspects. And then that will be a big help, because that will be another resource for them to lean on to come out of the isolation.
I think I totally agree with that. We have actually representing on our call here some of our partners that work very closely with teens and in peer-to-peer types of situations. So we have Audrey Sharp on here. She works for Lana'u Investing for Teens, and they do a lot of really great peer-to-peer support and behavioral health counseling and things like that. So I agree that that's definitely a protective factor and a strength in how we address these really big issues.
Yes, because a lot of times it's very difficult, even if you have teens or youth period in a group now, it's difficult to engage with them because of that isolated component during COVID. So you're like pulling teeth. So it's basically you have to meet them where they are. So that's why the use of technology is our best friend, because that's a bridge to pull them in to get to the point of face-to-face engagement is what I've been seeing so far as effective programs.
It almost feels like a catch-22 because here virtuality and social media can be part of the issue that we're facing in this isolating behavior, but also it can be a strength that we can use that we can leverage to support our teens and our youth and our young people. And I think promoting healthy education around social media use is also important. Helping them identify like what kind of messaging is not either healthy or relevant. So I think that's definitely something we can work on as public health professionals.
Absolutely. Absolutely.
Awesome. Well, again, we're going to be sending out an evaluation on today's presentation over the next 24 hours, along with also having an archive available if anybody attending would like to share that as well, or if anybody had missed today's presentation, it will be available for folks to view. And again, we'll probably have that ready tomorrow at some point. So with that, we don't see any more questions in the question box. We want to thank Stefanie for presenting on today's presentation. Thank you very much,
Yeah.
McGwitch. Thank you to Heather for coordinating. Thank you to everybody who attended today. And with that, we will give everybody back about 25 minutes of time for the day. And we hope you enjoy yourselves and have yourselves a wonderful day.
Thank you. Thank you.
Thank you very much.